Today's talk is going to be about the USANA difference. And when I sat down to make this presentation with the help of my team, it was really hard. And I'll tell you why is not because it's hard to find a point of difference. There's so much. How do we condense this down to something that we can all digest in a reasonable amount of time? So I'm not going to waste any time. I'm going to jump right into it. So where I believe USANA exceeds is in development of science-based products. And there's a lot of companies that produce products out there, but the difference is spending the time on the quality, the extra steps that it takes to really ensure quality. And then also, we've won so many awards for being a science-based company. And that really started with Dr. Wentz's vision. And I'll get to that in just a few minutes. But really, from the day one of USANA, it's been all about the science and having validated products that we could share with people. So for those who haven't ever come to Salt Lake City, this is a picture of the USANA facility from the air. I'm not sure why it's blurry. I think they did that for artistic effect, but our building's not blurry. You can see it very easily as you're coming in on the landing pattern for Salt Lake International Airport. That's why they've got USANA painted on the building, is so that people can spot it on the way in. But it's a huge facility. There's actually another duplicate of this almost exact same facility in Beijing right now. So USANA is not only set up in Salt Lake City, but we're also set up in China. And we're positioned to service 24 countries around the world. And this is a great place to work. I don't know if you guys can see my cursor. Can you see that? But right in that corner, that's my office right there. Okay, and I'm very fortunate because that used to be Dr. Wentz's office, and it used to be Dave Wentz's office before me. So I've inherited it from genius, and I intend to preserve that genius over a long period of time. So let's start at the very beginning. We make stuff. And so to make stuff, you have to get ingredients and components into the building. And so we have trucks arriving 24/7, 365. So around the clock, every single day of the year, we have trucks arriving with different ingredients that we put together into USANA products. And we vet all of our manufacturers ahead of time. So we're such a large manufacturer of nutritional products that we get to pick and choose among the very elites. And so we do quality assurance audits on the vendors. We do continual audits on their productivity, if they have any defects, things like that. And we only deal with the best companies. But even given that, we don't trust anybody. Okay, that's just the way Dr. Wentz set up the quality assurances program within USANA. Is we do so many, I'm going to show you, we do so many checks on products before they come in and before they go out, that this is one of the big USANA differences. This puts us way ahead of everybody in the industry. So anyway, so the products come into the USANA building, and they're immediately put into what's called quarantine. So when things enter our building, even though they're from a trusted distributor, people that we've worked with for years or decades, you never know. You never know what's in that box. So we put everything that comes into our facility into quarantine. And then we actually have technicians test every product that comes into USANA. So every ingredient is sampled by a technician who goes around. They check the paperwork on all the barrels of stuff that comes in. They physically sample the product. And then they bring these testing samples to the laboratory. And in the laboratory, we double check to make sure that the ingredients that have been delivered to us are exactly what they're supposed to be. But not only that, but we're also testing the purity of the ingredients to make sure there wasn't a mix-up, make sure there's no contamination or anything in there that would be dangerous for our people. So when we bring stuff in, we run it through a bunch of analytical equipment, and this analytical equipment samples the products, and we bring in thousands of products every single day. So you have to imagine that this is very automated and very specialized the way that we test things. We can test every product to find out not only is it exactly what we want, but also is there contamination in there? Is there things that we don't want in those products? So then it goes into microbiological testing, where even the best manufacturers run into issues sometimes where there is some sort of a contamination issue with the products. You read about it in the news all the time. There's just a whole bunch of lettuce and things recalled throughout the Midwest a few weeks ago because there was a contaminant in there that they didn't catch ahead of time. Well, see, something like that wouldn't have made it through the USANA process. So that would not have made it into our products. So we take it through microbiological testing. And once it passes all the testing, then we bring it in-house and start turning it into products. And our products are when we're blending them and putting them together according to the USANA formulas, we're testing them every step along the way. So this shows you like sort of the blending process and how things are, we bring the ingredients in and we blend them together, we put them into totes. And then we go ahead and move them forward if they pass all those tests, and we start turning them into actual product that gets the USANA seal of approval on it. So this is a tableting machine that I think it can produce about 1 or 2 million tablets a day. But you'd be surprised if you get a chance to tour through and you see this. We've got several of these machines, and they're just constantly churning out all sorts of USANA product to meet the needs of our consumers worldwide. This is a gel cap machine. This is something that we've started moving a lot towards soft gels. It gives us a lot of opportunities. I don't know if you guys know this, but we just invested about $30 million in a foods facility. So the building that's adjacent to USANA, so not only that giant building that you saw in the first photo, but we also own another building that's probably about half that size right next to it. And we started converting that to another production facility. And in that facility, we'll be able to produce all sorts of shakes, bars, all sorts of really cool dosage forms. We're looking at gummies. We're looking at all different chewables, just different things, because we realize we produce great products. I mean, the best in the world. But there are certain people that are not going to swallow a tablet or a pill. They're going to be looking for something else. So we're always looking at new dosage forms. Now, gummies have been kind of controversial because a lot of times they're loaded with sugar and they're not very healthy. And it's a lot of marketing story, but it's not really a healthy product. But we've been researching this now for over 10 years. And the gummy technology is actually to the point now where you can actually make it with probiotic ingredients, very low sugar, and you can make it taste great. And so these are things that we're looking at for the future. So then when the tablets and stuff is all produced, it moves on to the bottling facility. And we've got several of these bottling suites throughout the building. These are probably the most visible if you take a tour of the building. But this is where the product is actually put into bottles. There's all sorts of security checks to make sure that there's no contamination. Everything is labeled correctly. And then after stuff is finally produced, it's put into pallets and stored in a warehouse. But if you notice, there's another quarantine sticker on there. Okay, so even after we've tested it, manufactured it, and bottled it, we put it back into quarantine again. And then what do? We test it one more time. So we test the finished product to make sure that all the ingredients are in there at the exact labeled amount that they're supposed to be in there. We do another micro test to make sure that there's no chance that anything was introduced at our facility. And then finally, the products are passed out to the warehouse where they're sent out for distribution to our customers. So this is something that this is one of the big USANA differences is quality. Because I'm telling you, this is not required by the federal government. The testing, the multiple steps that we do, all of that is some of it is required, but most of it is not. Particularly, like when we bring an ingredient in from a manufacturer, we could actually just bring the ingredient in based on what the manufacturer says about it. We don't actually have to test it ourselves. It's not required by law to do that. But we do, because that's the way Dr. Wentz wanted it. Dr. Wentz is a very interesting man. He's just a wonderful man. He's a very nice guy, but he's pretty uptight. And one thing that he's uptight about is quality. And he's German. So, I mean, that kind of says it right there. So people that are German are very like Mercedes. They're very uptight about quality. And that's why their products that they produce tend to be some of the best in the world. And I appreciate that. I'm so proud that he stuck to that, because it would have been so easy to compromise. You probably could have made a whole lot more profit. You could have, easily slipped by compromising. And he's that kind of guy that just did not do that. So all of our products, when they come through, and this is really interesting on new products, now that Dr. Wentz isn't in the building every single day, he's emeritus status, is getting his signature on every product. So I'm telling you, it's not an easy task to get his signature. But when you get a USANA product, you'll see that Myron Wentz signature, the potency guarantee on the label. And he'll be double checking with me, holding me personally accountable. Did it go through all the tests? You didn't skip anything, did you? And I have to give him a straight answer, because I have to look him in the eye and tell him that everything is the right way. This is the way it's supposed to be. So this is the man himself. This is the guy that set up the quality of USANA. We are never going to compromise on this. Okay, if we did, we'd be dead. I mean, we'd just be another company that's out there. So this is something that we'll follow this vision. We'll follow this vision to the very, very end of the road, because it's so true that if you're meeting the genuine needs, and what he felt the genuine needs are, is that there wasn't any shortage of vitamins when he decided to start USANA, but there was a shortage of quality vitamins. Things that people could really rely on to power their bodies, things that athletes could use and really rely on to get their maximum nutrition. So anyway, so this is the vision of the man that we always follow. Another thing I want to share with you guys is that the research and development at USANA is continuing at full speed. We haven't missed a single day. So for this whole COVID epidemic that's been going on, USANA has been open 24/7 the entire time, because we saw this coming. We saw it hitting China. We saw it hitting Europe. We saw it coming to the United States. And so what we did was we sought permission with the government of Utah, to make sure that we were designated as an essential business, because we produce health products and medicines that people really need. And we qualified as an essential business. So USANA has always remained open. Now, non-essential employees that don't need to be in the office building, we've allowed them to work from home. And I'm telling you, the productivity is actually really shot through the roof. So we're finding that our productivity is actually much better, but this was just taken a few weeks. I think it was last week or the week before, when Dr. Oz came to visit my R&D team in the building. We're all wearing masks. We're all keeping our social distancing and things like that. But we're up to speed. We're doing all that we need to do. The great thing about research and development is that a lot of the research that we do towards validation and formulation of our products doesn't require us going to the university library anymore. Back in my day, I'd have to be digging through the stacks of the journals in the library and trying to find all these articles. Well, now almost everything's online. So if we have access to all the scientific databases. So my scientists and my regulatory people can work from home very easily and not miss a beat. And like I said, I believe our productivity has actually increased. So none of our products that we have under development have slowed down. We've been keeping up development throughout the entire pandemic process. So one thing Another thing that makes USANA very different, USANA difference, is our scientific and clinical research, because this stuff is not required by law. But it's something that we do because people want this, and increasingly consumers have access to a lot of information on the internet, and they're looking for this. So they'll be seeking out, they'll dig into USANA and see if there's actually something behind this company. And we're always proud to say that we do. We actually do clinical research, including human clinical research on our products. So you'll see our increasingly, particularly since I came on board about 5 years ago, you're going to be seeing a lot of scientific journals and a lot of scientific articles coming out from USANA, because I believe that's very important. It supports the validation of our products. It supports the patenting of our products when we file patents on them. But then also, I know that consumers are out there. They're not going to read a scientific journal article. They're not going to, they're not going to understand the details, but they're going to know whether or not you actually have them. And so that's something that's very important to me, is I don't want to ever have to look somebody in the eye and say, that this is really all smoke and mirrors. It's got to be real science. And that's what Dr. Wentz intended. And that's what we're continuing to do. So these are the reasons that we do clinical research, is to make sure that they're safe, make sure the ingredients are pure, and then also make sure that there's no unanticipated reactions. So, for example, our Copa Prime, I'll go into that a little bit later. That's a recently launched product. It's launching throughout the world right now. But Copa Prime is what's called a nootropic product. So it enhances brain function. And I'll tell you, when I saw the results of how much it enhances brain function, first of all, I couldn't believe how much it did. I mean, we found statistically measurable results within one dose of taking the product. So within 45 minutes after taking one dose of the product, there were dramatic effects. Well, that had me a little concerned. I'm like, well, how powerful that's so powerful. Could there be any negative effects to that? So whenever we do clinical studies, we're also looking for negative effects, because we not only want to validate the positive, we want to rule out that there's any negative effects from this product. So this is the science that makes USANA a leader in the world. You know what? There's always going to be cheap products out there. There's always going to be knockoffs out there. And you know what? If that's what they want to buy, then fine, then let them buy that, But there's always going to be a market for the very best. Mercedes is never going to go out of business. USANA is never going to go out of business. Somebody's always going to want the quality, and they're going to be willing to pay for it because they've been through enough junk that they paid for and threw it in the trash can, that they're willing to spend a little bit more to get the very best. Okay, so let me go forward. So this is some of the very earliest research that was published by USANA. This was done at Boston University several years ago, and it validated the proflavanol products. And so this started the tradition of USANA not only just putting ingredients together, but also clinically testing products to make sure that they do the things that we want. Oh, this is really interesting, because these are two papers that were just published in the Journal of Obesity and Nutrition and Metabolism. These were the first ones that we did in conjunction with Baby Care, which is USANA in China. And so these were published in prestigious journals, and these showed the beneficial effects of Nutrimil in Chinese citizens, and it caught a lot of attention. So as a matter of fact, it's resulted in a huge boost in business in China, and a lot of backing by particularly government officials, because that we went ahead and did these clinical studies, and they turned out so positive. Another paper that was just published, and there's so many, I can't put them all up on the screen, but I'm just pointing out a few. But if you go to Ask the Scientist, you can easily access all of the articles that have been published. In a lot of cases, they're open access, so you can actually read it if you're sleepy at night and you feel like reading a scientific journal. But the thing is, people are looking to make sure it's there. And what you're going to see over the next few years is you're going to see just a huge surge in publications there, because this is something that Dr. Wentz and I feel very strongly about. We had talks about this, many talks about this over the last 4 or 5 years. And I feel very strongly in publishing scientific research in third-party journals. And he does too. He supports that. And so you're going to be seeing USANA publishing a lot of stuff. And it's going to be in pretty prestigious journals too. And you'll be able to access it as much as possible. So this is one where we were testing the effects of Cell Essentials. This was Cell Essentials at the very beginning, before it was even Cell Essentials. And we were looking at markers of cardiovascular health. And there's a lot of companies out there that make claims around this, and they don't actually do the research to prove it. But USANA went ahead and did the research to prove this. And I'll tell you later on, I'll show you how this research was part of what led to us getting a really nice US patent just a few weeks ago. So this is some of the most recent research from nutritional neuroscience. This is what I was telling you about the COPA Prime research that we did in Australia at Central Queensland University. And it's done with one of the most prestigious neuroscientists in the world, Dr. Talitha Best. And Talitha, I've known her since she was a graduate student, brilliant scientist. And now she's like one of the preeminent global scientists in neurological health. And so this is an area that USANA is going to definitely be very heavily involved in, is brain health. Because there's so much, and there's so much need out there. Like Dr. Wentz said, when you meet a need, and there's a huge amount of need out there right now, particularly in populations that have a lot of elderly. Like if you go to Japan, there's a huge elderly population there. They treat them very well, but the problem is that, you know, once people reach a certain age, if they haven't taken care of themselves and things, they start losing brain capacity. It's one of those things that people say it's an inevitable part of aging, but I think it can be managed. I think that with proper nutrition and proper intervention, a lot of those effects can be managed if you deal with it ahead of time. So anyway, so this is a publication that was very exciting for us. We also, even things like skincare, you know, you don't have to clinically test skincare. A lot of companies just throw it together, put Jessica Alba on the label, and they start selling skincare. And there you go. We've got skincare. We're skincare experts. But a good company that really cares about science will actually do clinical studies on all their skincare. And I'll tell you, I've worked with Stevens and Associates for almost a decade now. They're the best in the world as far as testing skincare. They've got offices in Texas, California, and Tokyo, in Ginza in Tokyo. And they're fantastic for testing all sorts of skincare. I got a call from them after we did our last clinical studies, and their people wanted our skincare. Like, how do we buy this? Because they clinically test skincare all the time. And the results of this product were so great, so much better than what they've tested with other skincare products, that they were really impressed. They wanted to know how they could get it for their people that work for them. Another publication that we've got, these are two that are in press right now. One of them, USANA, essential oils is something that's been around for a long time. There's a lot of companies that are based on essential oils. There's, particularly here in Utah, there's a lot of them. None of them have any scientists working for them. I got to tell you, I hired the last scientist from doTERRA about 2 years ago to my organization, and he was really frustrated because nobody did any science there, and he wanted to work for a science company. So anyway, so he came in. And we've been studying essential oils, but I asked Dr. Wentz, how do you feel about essential oils? He said, well, they're good. We use them at Sonavive, but you have to have validation behind it. You know, this can't be just like, you know, it can't be just some sort of goofy product. It's got to be something that's validated. So we developed a mood enhancing essential oil blend. And then we took the time to put it through human clinical studies at the University of Utah, the Brain Institute there. And we got tremendous effects on mood, heart rate, and blood pressure. So from this essential oil blend, people were actually getting positive, beneficial, measurable scientific effects. So this is something that's in our product pipeline for the short-term future. I can't tell you ahead of time, anything about products being launched, but this is something that we've done clinical research on. It's about to be published, so I think it's pretty exciting. Another thing is a survey that we did on Cellsentials, and this is really cool because it's a multivitamin. Cellsentials is the top in the world multivitamin, but there's a lot of multivitamins out there, and nobody's ever tested one to actually see what it does. And we tested our product, and we also compared it to what's called the NHANES data, which is the National Institute of Health. They've been doing this survey for 30 years. We compared it to the health of people that are in the NHANES study, and we found that people have very significant differences in certain biomarkers, such as cardiovascular health, people that are on our products. So this is something that is publishable. You're going to see it in a scientific journal very soon. And this is something that's going to catch the eye, particularly of physicians, because people are always looking at reducing these biomarkers. And there's a lot of hype out there about things that claim to do that, but there's very few that are scientifically validated and published in journals. And so this is something that's really going to help enhance USANA going forward. These are some of our scientific partners that we work with. Now, this slide probably needs to be updated because we've got a whole lot more new partners, particularly in Australia, China, the United States, and even in Europe. We've got some in Belgium that we're partnering with now. But here's my point of view, is USANA's got about 86 people in our research and development team, which is a lot of scientists. And so we've got medical doctors, we've got nutritionists, we've got PhDs, biochemists, we've got all sorts of technicians, we've got all sorts of people. But when it comes to clinical studies, I'd much rather prefer to partner with a major university because they can do the studies more efficiently. They can do them with a wider audience. And then also we get the accreditation of being affiliated with an independent institution. Like, you can't bribe a university to give you a good study. You basically pay them an amount, they do the study, and if the results come out good or bad, they're going to publish. They tell you ahead of time they're going to publish them anyway. And so to have these kind of partners with us, and we've had just a successful, very good track record of positive studies. So this is something you're going to see continuing to increase over time. My predecessors at USANA, Dr. Wentz, before me, Tim Wood, some of those great guys that had the vision, they steered USANA in this type of direction. And this is something that I want to steer us back in this direction again, because I want to be back to the very, very best days when USANA is growing fast and we're recognized as the world leader because we're doing the right thing, not because this is the way that you make. Spending on clinical studies that you don't have to do, that's an expensive proposition. And a lot of companies that I've met with, they won't spend the money to do that. I've never had an issue getting money from our board of directors to fund a clinical study if I feel strongly about it. As a matter of fact, I had one of the board members who's very financially oriented, great guy, but very financially oriented. And after my presentation, he said, "What else do you need? What else can we give you?" And it was fantastic. To have that kind of view on the board of directors of a major U.S. corporation, I'm telling you, you have no idea how rare that is, but it's refreshing, rare, and it's definitely a USANA difference. So another thing that USANA does that's different is we're members of major trade associations. So the Natural Product Alliance, you can read these off the screen. The thing is that we want to make sure that we're a voice at the table when the government is considering regulations, when FDA is considering enforcement action, things like that. We want to be that voice, that intelligent, reasonable voice that they listen to when they're making policy decisions. And so this is something that we're very much committed to. It takes a lot of money for membership. It takes a lot of time being on those boards and sitting and influencing those people. But I'm telling you, that is a USANA difference right there. USANA difference right here. We're FDA registered, which is really just a fantastic thing. It means that the FDA comes and visits us occasionally and tours our facilities, and they look at all our records, and they sit in our office and, you know, ask for this and ask for that, ask for this. And our people accommodate them, and they always leave satisfied. They always leave happy because they know we're the good guys. We're the good players. We're the guys that they want everybody to be like. Another group that comes and visits us regularly is the Australian government, the TGA, the Therapeutic Good Administration. And this is another, like, they won't accept an FDA certificate. If you want to sell in Australia and New Zealand, you have to have this TGA certificate and inspection, and they have the facility. And the cool thing is that they're supposed to inspect it every single year, and good, that they've actually put us onto skip year testing. So they come and only visit us now every 3 years because we perform so well that we're on their good list, and we're one of those companies that they actually make an example of. So we're very popular in Australia as well as in the United States. But we're also popular around the world. Like, for example, these are some of the agencies that we deal with on a daily basis. So these are FDAs, TGAs, Health Canada. Health Canada is really tough, I got to tell you, Krista. Health Canada is probably some of the highest standards in the world. As a matter of fact, I've told my team that right now, we build all of our products to Health Canada standards, because Health Canada is probably Health Canada and TGA in Australia are the strictest in the world. FDA, if you just build to US FDA standards, you're going to have a really crappy product, and it's actually not going to be accepted by most other countries. So we built to Canadian and Australian standards, and we're able to get into most countries. So that's been really helpful to us. We adhere to all sorts of international standards. The USP, which is United States Pharmacopoeia, we've got certification from them. A lot of our products are also certified as kosher, and they're also certified in certain countries as halal. So in countries where that is required and desired, we're certainly able to meet those standards. Our products are of high enough quality that we don't really worry about that. We can meet any kind of standard with our products. So we also have USP and NF. NSF is, they used to be the National Sanitary Foundation, but these guys are the experts in quality around the world. So NSF is the hardest standard to obtain. And not only do we have one NSF standard, but we've actually got 3 different NSF standards. So we have several certifications with NSF, including their highest standard, which is NSF certified for sports. Okay, and this is really tough, and I'll tell you why. And that's why we check every ingredient that comes in the door of our building. You know, you saw that whole process of how we do this. And the reason we do that is because inadvertently, in some ingredients, whether they do it on purpose or accidentally, there may be some performance enhancing compounds introduced into ingredients. And since we've got professional athletes, thousands and thousands of professional athletes all over the world using our products, we cannot afford to do that. So we test all of our ingredients coming in. And then not only that, but we send the ones that are certified for sport, we actually send those out to the NSF laboratory And they're actually tested there to quadruple check to see if there's anything in there. And so very few companies qualify for that. USANA qualifies for that. To the point where we even have $1 million guarantee for athletes. We have so many Olympic caliber professional athletes, up and coming champions taking our products that, they've got a lot at risk if they're taking dietary supplements. And this used to happen a lot. It's happening less now, thank God. But it still happens where these guys end up testing positive from something that they didn't even know that they took. They took some energy performance thing that they found on the internet, and they end up testing positive for some banned substance. And that happens all the time. It's not hard to set up an internet site and to set up a site that's really glitzy and looks like you've got this great product and people think that you've tested and everything. And it turns out that somebody's making that in their garage. That's Uncle Ben's old canning machine that they're putting to work, making some energy drink. So this is something that I think is really important. It's a big USANA difference, is the fact we're willing to put $1 million on the line. We're willing to have thousands of athletes take our products and put $1 million on the line. And we've never, ever paid that out, ever. And the reason is our products are 100% tested and 100% safe. So these are some of the athletes that take our products and some of the teams that take our products. And I'll tell you, of all the slides that I see for USANA and everything that I see, this one really speaks to me. And it speaks to me because these are the best of the best. I mean, I'm glad they're on my side, because if I ran into some of these guys, I'd be so scared if they were my enemy, because they're so powerful and they're so tough, So why are they taking USANA? Well, they're taking it for a lot of reasons. A lot of them are at the peak of their performance of their body. Their body is at their limit. These guys, when they're trying to set a new world record, a new Olympic record, I mean, literally the best humans in the world set that last record, and these guys are trying to break it, which means they're going to push their body somehow further than what those other record breakers did. And that's just so impressive. And to use USANA Nutrition to do that is just amazing. And then also these athletes train very hard every single day. And one thing that they all have to do is they have to recover once they've trained. Because when you're training, you're breaking down muscle, and the strength gains actually come during the recovery period. So these guys, when they sleep at night, those nutrients need to be in their body to repair all that tissue and make sure that they're healing up not only as good as they were, but even stronger than they were. So to me, this slide says it all, because I'm not one of those guys. I'm not one of those Ferraris, one of those ladies that are in there, these elite athletes. I wish I was, but I'm not. But if it works for them, it's certainly going to work for me. And I think that says it all right there. So the benefits, why did these guys take it? Is there's so many benefits, from even the basics, the essentials, the essentials that people take on a daily basis. You've got immune support, you've got energy, brain functioning, improved brain functioning, eyes, bones. Everything in your body works better when you don't have nutritional deficiencies. And that was Dr. Wentz's goal, was to make sure that your body, as he says, gets nutrified. And nutrified means getting an abundance of everything that your cells need, but not too much to put a stress on your body. And so that's our goal, is to make sure that everybody is nutrified. Another benefit of doing the science behind a product and being diligent about following it through is you get patents. And so recently, USANA was issued a United States patent for our intelligence technology. And guys, I've got dozens of nutritional patents that I filed over the years, and they used to be really easy to get. Okay, probably 20 years ago, they weren't that hard to get. But there's so much what they call prior art right now around patents that's almost impossible unless you've got a lot of scientific effort to get a patent, a new patent. And USANA scientists starting even before I got there, but finished along the way. We just recently received a patent on our intelligence technology, which is amazing because it only took us about 5 years to get this patent. And usually the average time to get a patent is about 10 years. And sometimes it could be as much as 18 years to get a patent. And so that means the science is compelling enough that the patent examiners felt that USANA definitely had a novel technology here. And the technology that we developed in the intelligence, USANA has always been about nourish, and we've always been about protect. So the first generation of nutritionals that Dr. Wentz produced was all about getting the right amount of vitamins and minerals into the body in bioavailable form. So that's the nourish. And we've never given that up. We just build on that technology. The later generation USANA products had a lot of antioxidants in them because Dr. Wentz was one of the first people to realize that protecting the cells and preventing damage to the cells was very important. And so he developed antioxidant technology that took USANA to the second generation. The third generation of USANA products is all about Renew. And Renew is intelligence technology. And what it's doing is I won't say it's tricking your cells, because I don't believe we're tricking them, but we're coercing your cells into renewing themselves on a more regular basis. So when cells get old, they're supposed to go through what's called apoptosis, which is where the cell basically commits suicide, and the materials within your cell are recycled into new organelles, and it creates a new cell. A lot of times what happens when people are young and they look kind of old is because they've got some sort of defect with this renew process. You know, it could be the things they're eating, it could be the drugs that they're taking, it could be the way they're treating their body. I don't know. But anyway, Renew is something that's very important. And that's where USANA really has excelled in this third generation, is we've come up with a way of what's called unlocking the code. So basically using natural compounds to trigger cell signaling processes within the body to cause your cells to renew themselves. So basically, when your cells get old, they're not just going to hang around and pollute and cause a lot of damage in your body, but they're actually going to do what they're supposed to do and regenerate themselves. And the way we do this right now is through certain natural compounds called the intelligence compounds. And these are some of the current ones that we use, things like alpha lipoic acid, curcumin, quercetin, rutin. Those are both flavonoids. Hesperidin is another flavonoid. Resveratrol, that's a phenolic compound. And then olivol, which is another phenolic compound. But these are natural compounds that occur in certain foods, but they're in fairly small amounts. And we figured out ways of isolating these and putting them in fairly large amounts in the supplements so that they can accomplish what a healthy diet would accomplish in most people. So these are some of the things that are USANA difference. And I'm just like, I don't know if you can tell, but I love talking about it. I get excited about it. This is my passion. This has been my life's passion. When I was a 5-year-old boy, dreaming of something to do in life, this is exactly what I dreamed to do. And it's amazing to be able to do it. So thank you guys for having me on and tolerating me and listening to my stuff.
Dr. Sinnott, can I just tell you, I am always inspired by people who dream big and then live that dream. You are the prime example of not only living the dream, but sharing that knowledge and putting it into such a way that the whole world can take advantage of that. And really, we thank you for giving us that opportunity to learn from you. And my brain feels nutrified.
Absolutely. I took the Copa Prime right before this, and it does work really quick. I felt focused and alert. But for those of you, all 2,000 plus of you guys who are here, think back to when you first experienced and felt the USANA difference. Like, think back to that time. Like, I remember it vividly, and I was like, I feel different. There's a pep in my step. I woke up feeling awake. My body was nutrified. So it was just such a great feeling. So think back to that time and then apply this knowledge and help us share USANA with the world, because that is our vision, right, Jay?
That's the vision, and I'm excited about it more than ever. And to tell you the truth, I wasn't someone in school who could sit and listen, and I actually really enjoy listening to everything you're saying. And so do the 2,000 plus people that are on this call. In fact, we have some questions that just came in, and we wanted to share those with you and see if you could, maybe shed some light or give some clarification, because people are excited. Here's a great question. And this one is, what do other companies do, quote unquote, wrong that USANA does right?
Okay, that's a great question, Andre. Thank you. So I mean, it's kind of hard to say because, okay, the wrongest companies, and there are actually some of these, are the ones that actually violate the law. So the ones that actually don't even follow any law, they just put whatever they feel like in a bottle and they sell it in, sketchy ways. Okay, but there's a lot of companies that are selling legitimate nutritionals that are legal in the United States, but it doesn't take much. All it honestly takes is anybody could put together a formula. You have to notify the FDA 90 days in advance that you're going to sell it. You tell them what claims you're going to make about it, and you send them a letter and tell them that you're going to do that. They never look at it. They never respond to it. But if you did that 90 days in advance, then you're technically legal to sell the dietary supplement in the United States. Now, countries like Canada and Australia, I think, are doing the right thing. And I think the United States should move towards this, which is called pre-market approval. So if I want to sell something in Canada, if I want to sell a health product in Canada, I notify Health Canada, hey, I've got this great thing. They're going to correspond with me and they're going to say, okay, show us all your data. Show us your clinical studies, show us your proof. And I send them a dossier and they check it. And if everything checks out and it's not easy to get their approval, then they'll give you a number that allows you to sell within the country. It's much harder to get. So that's pre-market approval. And then some countries like China have adopted almost like the Canadian and Australian system. So these things aren't required by law. But again, USANA has been doing these since day one. So the thing is that when these things became law, it just gave us more market share, and then the other shady guys fall by the wayside. But you know what? Don't trust what you believe, what you hear on the internet. You guys all know that. It's not hard to make an ad on the internet, but look for their certification. Look for their TGA certification, their FDA. Are they selling in Canada? If they are, then they might be a good company.
That's great. And I think that actually segues into the second question. You touched on this really nicely, and maybe you could explain why do we elect to not only be an FDA registered facility, why do we elect to do TGA, and then we saw all those other health organizations. To you, as a chief scientific officer, what does it mean to continually add to those relationships? And the list from when I started till now, it just keeps getting longer and longer. What inspires you to continue to seek those out and add those to the docket of people who are associated with, as far as TGA, FDA, et cetera, et cetera?
Yeah, that's a great question, Andre. Well, it stems from Dr. Wentz's vision. It's like, who do you want to be when you grow up? And his vision was he always wanted to be the most credible player in the industry. There's a lot of people that's not their goal. Their goal is revenue and sales, and, they don't really care about that. But that was literally his vision from day one. And you know what? I still talk to him every day, not every day, but I talk to him a lot. And he still insists on that every single day. That's who USANA is. So, I mean, there's plenty of choices in the world, in the universe. People can choose whoever they want. But if you really want the very best, and you understand the difference, then USANA is the one. I'll stop there.
Absolutely. I have a couple questions for you too that came in. So I love this one. I really love it a lot because I agree. USANA holds so much value and is very, it's really affordable for even the average person. So how are we able to produce such an incredibly value-packed product at the value that we are?
Yeah, that's a good question, Krista. Yeah, so the value proposition, even though, I would say we're more expensive than something you buy at a discount store or a big box store. We're still affordable for most people. And I'll tell you, it's a great investment. If people look at their overall healthcare expenses and things like that, we're a very small portion. Nutrition's a very small portion of that. The way we're able to control costs is by manufacturing ourselves. And again, this was something that Dr. Wentz felt very strongly about. And our current president, Jim Brown, really helped Dr. Wentz with this vision and building this out. So we can make things more cost efficiently than most people can just because we control our own production. We've got so many people at USANA that are 10 and 20-year veterans of the company. They love USANA. They come to work every day. They're very productive. And that's the kind of company you want to run. So those are the reasons is we control our production. We've got loyal people. They're very efficient. They're very productive. And we're just very blessed that was the foundation that USANA was built on. And we're going to preserve that forever.
Fantastic. All right. And then if we have time for one last question, I know this is going to be a tricky one, but I'm going to ask it anyways. So if there was one single takeaway, if someone were to ask me on the street right now, why is USANA the best? What makes USANA so great? What is the single standalone thing you think that really should be highlighted?
Okay. All right. So during the presentation, we went through probably 6 different things that I feel are major USANA differences. But again, I'll go back to that slide of the athletes. The Olympic athletes, the world-class caliber athletes that are using our products. We've got thousands around the world. As a matter of fact, the Chinese Olympic team, their training center actually contacted USANA several years back and said, you guys are doing great. How do we get this stuff? So that's the kind of reputation we have. And to me, that just speaks volumes because if the people that are pushing their body to the utmost of anybody in the world, like some of these guys are on the verge of death, literally, when they're done with their training for the day. If they trust USANA, I mean, come on, man. It's good enough for me. And I'll tell you, you look great. Andre looks great. I look great. So this stuff works. And if anybody wants to join us, they should probably start taking USANA products.
Absolutely. Fantastic.
That was great. You know what? There's, again, 2,000 people, over 5,000 people in 2 weeks have heard you online. And next week, we have you back with us, same time, same bat channel, talking about personal health and accountability. Is there anything you want to say about that coming up? Why should we tune in? I mean, obviously, we know why we should tune in. But you want to give a little plug for that next week?
Yeah, so personal health and accountability is, Andre, that's kind of what it boils down to. You know that. Mm-hmm. So I can give you all the science. I can give you all the reasons why people should take USANA, but there's still people that are going to say no to the proposition. So I want to come from a different point of view, not from the scientific point of view, but personal accountability point of view, and give another reason why people should do this. I'm just trying to come from a bunch of different angles because I'm trying to reason with people. It's like, this is the best investment you can make. Like, why would you not make this investment? Yes.
Absolutely. Everyone who's listening, you're worth it. Take your USANA.
Exactly.
Well, Dr. Rob, thank you for your time. Thank you for your energy. Thank you for your knowledge. Thank you, all of you who are listening. Next week, get your friends and family on. Personal health and accountability is something that applies to everyone. And we are so blessed and grateful to have the great Dr. Rob Sennett here with us for the next 2 weeks. Thank you again, guys.
Thank you, everyone. Enjoy your evening or morning or whatever time it is.
Happy Canada Day.